We had help from the organisations that we work for and work with. One of them being the Dorset Adult and Asperger's Association, who are really key in helping us decide what to put in a room and what works well for people with sensory needs and sort of autism, Asperger's, that type of thing. And also another group called the Dorset Children's Foundation, who help children with severe disabilities. And I'd also done a bit of research with NHS Wessex, who helped us come up with the idea of maybe quieter sessions where the lighting's a bit lower, and just a nicer feel, because it's quite clinical walking into an environment like this, very white, very bright, very stark, and for somebody who's got sensory issues, it's an overload for them. So we wanted to sort of bring that down, different sights, different smells, different sounds for them. So yeah, looking at all the senses for them. I would describe the room as being a very calm space for people to access, and it can be adapted to what they need it to be, which is really important. And to be involved in it just feels amazing. I'm really, really proud of the room, because I just think so many people will benefit from using it, and that makes me really proud and really pleased that we're able to be part of that, because I know there are so many people that do need help sensory wise and do need that environment where they can feel safe and calm, and it just brings it down for them. So if we can do something really small that will make it a better experience for them and their families, I'm really pleased with that.
The rooms are designed to relax people, to calm them, and I guess to distract them as well from what's going on around. And I think it's been well received. It certainly seems to have been successful. We are able to book people in specifically for the sensory room, so they'll come here because the rooms are in existence.
One of my favourite things in the room is the fishes, and try and look on them every time I come in on a shift. But it's just the general ambience with the lighting and the furnishing, where it's a relaxing, quiet atmosphere.
I think it's absolutely wonderful when especially you get the smaller children come in, and it's a place where they can be a bit more relaxed, because it is very clinical here. So when they come in and they see the room, and it's just their faces, and it's quite a scary thing for children, but when they come in, they immediately relax, and that gives you a bit of joy, because you know that you're helping them to relax, and they're also getting something that's potentially a lifesaver, I guess. I think for me it isn't just about children. Also we have adults as well who are very nervous or prone to fainting, and sometimes it doesn't get picked up by the clinical staff, but we can see it because we're in the waiting room with them, and so then we can find a member of staff and say, oh, I think maybe this person it would be better for them maybe to be in the sensory room. And again, it's that feeling that you've helped someone, because when they get into the sensory room, then adults relax. Because we all like stuff like that. We all like sparkly lights and fishes and stuff, don't we? So, and it's a distraction.
It's just really a good feeling. It's it's an opportunity through CAN. It's been an opportunity to be part of something. It really is a really good feeling.
It's made a massive difference. Sometimes people have come in and they've been so worried and so scared, and the thought of trying to go into one of the big pods to be vaccinated, it's just too daunting for them. So they've been able to bring them down to this space, which obviously, as you can see, is all very well lit up, very sensory based. It just calms them down. It calms sometimes with children, the parents down as well. And from a staffing point of view, we are away from the noise, so we can spend the time with that person and help reassure them. Sometimes people are booked in, so we know that they're coming, but normally as well, when they come into the unit, they may say to the receptionist, I'm very worried, very scared, and the receptionist immediately will come down and get either myself or the manager on duty, and we will then escort them straight down here rather than making them wait or anything, just to get them done as soon as possible. And the work the volunteers did, we couldn't have done this without them, and we all worked together to create the space and just to make it feel nice and safe for everybody that came in. I think in this day and age, we all appreciate a calm, relaxed environment. It doesn't matter whether you're 5 or you're 85. It's just something I feel that, especially with the last 2 years, the way the pandemic has been, it just helps reassure people, calms them down, and enables them to potentially come and get a vaccine that they may not have been brave enough to go and get.
The room that we use, which has been set up very relaxed kind of way with a nice soft armchair and like lava lamps, are very good and very restful for those who are sometimes very anxious about, an unknown situation to them. So particularly for their first vaccines, it's a very helpful, calm environment to bring them into with a nice soft voice and delivery of the vaccine, which means that they perhaps for subsequent vaccines will be much more relaxed and at ease to have their vaccines. And there are many people that we've seen, children and adults, who have been unable to have their vaccines under normal circumstances, but who've been rebooked to come to this quiet room, and we've been able to give them vaccines so they wouldn't have had it otherwise. So it's been absolutely indispensable, really. I've seen it in use, I have used it myself, and very often we can see, as the patient and their family come in through the side door just behind me, we can see that they're going to be best served by being in a quiet environment. And very often the lady or gentleman who sees them in at the front desk is able to divert them or let us know early on, even if they haven't been booked specifically for that room, that they may be appropriate for it, and we can divert them then. For a particular cohort, I think it's really helpful. Often there's families of maybe 3 children, and all of whom have become rather anxious about it, and the fact that they can go in as a whole family into that room without feeling that they're imposing or putting on, in other words, to an environment where they may feel a bit awkward about otherwise. They know that they can just come, have a quiet room all together, and we can vaccinate them all at the same time in a nice, quiet, peaceful environment, which is great.
What's really nice about Kings Park is that we're able to offer people a different entrance to come into, so they can come in around the side of the building. They're met by a named member of staff, and they come straight into the sensory room. And for people who have got children with additional needs or adults with additional needs, it's really important that we make that journey as comfortable as possible for them. So families, it's the reassurance that they know where they're going and who they're seeing, and then they're in a room that can be adjusted to that child or adult's needs. We had one lady in particular who was coming in who had Tourette's and hadn't taken her medication that day and was ticking and quite anxious about coming in. She walked into the room, immediately calmed down, was able to have the injection, and went leaving really relieved, I think. And that's really important for people to know that there is a space that they can come that's safe, that can be used by their child, and that they feel comfortable in it. Volunteers are key. I think from the minute somebody comes into the site, they're welcomed by a member of staff, member of the volunteer team outside, and it's that reassurance that they're in the right place to start off with and where they can park, that information, and then being welcomed into the site and being shown where to go, because it is quite daunting and people probably don't know exactly what's going to happen, and it's the fear of what's coming up. So the volunteers are really able to be a welcoming face and provide a really great sort of comforting service, and asking people how they are afterwards, and they're just a great. I think it's vital. I think there's so many people in the communities that do have sensory needs and additional needs, that it isn't just limited to the BCP area, it's across the country, and to have something like this is, I think, really vital, to be able to give people a space that they can come along and feel relaxed in.
Obviously, when the pandemic began, all of our healthcare professionals, we all pulled together from all different strains of life, and I think to create something like this in such a unique space needs recognising, and we should know as nurses, we don't normally shout or say how brilliant we are normally, and I think working together with the volunteers, we should be shouting from the rooftops how impressive this is, how the great collaboration has been, and what an impact it actually has had on patients' lives, really.
People that we've seen, children and adults, who've been unable to have their vaccines under normal circumstances, but who've been rebooked to come to this quiet room, and we've been able to give them vaccines, so they wouldn't have had it otherwise. So it's been absolutely indispensable, really.
I think we've shown great innovation, really. The room that we've done has been, brought about by so many different people, not just ourselves, the volunteers, but different community groups that work with people with additional needs.
I think for us it would maybe be a recognition of the hard work that people have put in, especially people like Liz and Terry, who actually put the room together, and it was their concept and their idea. And I think it would be such a recognition for all the hard work that we've done.